Alright, welcome everyone to the 1-year anniversary of the Health Information Portal. My name is Nienke Schutte.
And I'm Miriam Sazer.
And we welcome you from Cienzano, Brussels. It is great to see how colleagues from all over the corners of Europe are joining us today. We are here to celebrate the 1-year anniversary of our Health Information Portal and to introduce you to its numerous new features and developments. The portal was first launched in May last year, and it has been growing extensively ever since. Thanks to the help of so many colleagues in Europe, we could never thank you enough for all your support. The Health Information Portal is a service that is provided to you by the Population Health Information Research Infrastructure, or short, FIRI. On this portal, catalogs of population health information sources from both national and international organizations are findable through one single health information portal.
So what can you expect from this meeting? The event will last approximately 1 hour. We will start with a short interview with our colleague Hanna Tolonen from the Finnish Institute of Health and Welfare. Anna will walk us through the main steps of the portal and how it developed over time. After that, we're going to have a live demonstration with the help of a researcher selected from our community, Marika Borsch, and we will show you how the portal can help you with your research and your daily activities. After this, we have two colleagues from FIRE that will introduce you to the newest section of the portal, the COVID-19 corner and the capacity building section. After that, our colleague Pascal will show you one of the activities we will be working on in the upcoming weeks and months on how to make the portal more machine readable. After this, we have left some time to answer all your questions, so please, in the meantime, feel free to add them in the chat and we will either be answering them there or we'll be taking them up live. We have prepared a hashtag Health Information Portal that we really recommend you to use if you would like to tweet about the event. I think we are ready to start.
I think so too. Don't forget to follow FIRI on Twitter, and our colleague Barthélemy will post the thread also in the chat, so you can follow us on Twitter there. And I think indeed we are ready to start. So this Health Information Portal celebrates its first year anniversary today. But what were the building blocks of this Health Information Portal? Hanna Tolonen, the research manager at the Finnish Institute for Health and Welfare, with more than 20 years of experience in health research, is live with us here today. She is coordinating the developments on this portal and is a key member of the FIRI consortium. So, Hanna, thank you so much for taking the time to join us here in Brussels. Could you maybe describe how the portal came about?
Well, the portal development is a long process. I would say that approximately 5 years ago, when we established the Joint Action on Health Information, the INFACT, we started discussing that even though there's a lot of health information in Europe available, it's really fragmented and it's like going to every single corner store to find the material you would need for your research. And we started developing the concept of centralized portal where all that information could be found. So the basic concept of the Health Information Portal was developed within the INFACT, but afterwards we have been developing it further and taking more technical steps to get it actually functioning within the FIRI project, and also during discussions of the depot, the distributed infrastructure on health population. And today, we really are celebrating having a one-stop shop for the health information in Europe in the format of the Health Information Portal.
So you were saying the portal is building on several initiatives, so the Joint Action Health Information, for example. So could you maybe highlight what elements of the portal are built currently within the FIRI project or have been built during the FIRI project?
So FIRI was the big step to get the technical implementation of the portal really ongoing. And within the FIRI, we have been putting material on the national nodes on the portal, several health information projects in Europe, all the networks. But the key points which have been added when the FIRI on the portal are the catalogs of health information sources, so data, health information data which is scattered around the Europe. Research projects within the European context. There's another catalog on those for the capacity building activities on which we will be hearing more later on. Something which came up during the COVID pandemic is our COVID corner. And that's really important and been supporting quite a lot of national actors because we've been able to collect information on the COVID measures in one place to be easily foundable.
So you're bringing together a lot of different elements on the same portal. So what would you say were the biggest challenges when you were building this portal?
One would imagine that biggest challenge is to getting the information, but that hasn't been a challenge because the countries are really eager to share the information and bringing them together. So I would say the biggest challenge has been a technical one. So whenever you're building a portal, you need to think first the big picture, how it would look, what would be the functionalities on it, and establishing those step by step. But as we all know that whenever you're putting up a portal or any technical solution, there always is step forward, step backwards, because you realize that something is not working or you need to enhance it somehow. And occasionally that's been very frustrating when you have a lot of ideas and you would like to rush ahead with the materials to be put on portal, but we need to tackle with those more technical details.
I can imagine. But despite these technical difficulties, the portal is already online for a year. So I was wondering, this big portal with population health and healthcare data, how does this fit in this big European landscape and all its existing infrastructures?
Yeah, as you said, there's a huge amount of infrastructures in Europe currently, and more are popping up, which is good because we need those. From health side, the currently existing infrastructures are mainly on the clinical data. And what we are bringing new is now the population perspective, because when we are looking for the public health perspective, we need to look population in total, not only those who are seeking medical care. So our portal, Health Information Portal, is bringing that new addition to the landscape of infrastructures through the population information.
And now we're celebrating its anniversary. But of course, the work doesn't stop there. So I was wondering, what's next? Could you give us a glimpse into the future?
Well, as you said, work doesn't stop there. We have plenty of ideas how to enhance our portal, how to add new information there. I think the first steps are to make it more interoperable and more machine readable, and Pascal will be talking about that a little bit later. But obviously we also have a lot of ideas what kind of new functionalities, new information we could be adding to the portal. And those are the next steps to enhance and enrich the information we currently have. And obviously for the catalogs which are already existing, new material starts to accumulate there and it's getting more and more usable for the researchers.
Thank you, Hannah. I think it's very interesting to see this journey, how the portal came about, and we're all very much looking forward to see what's next.
Thank you.
Thank you so much for your intervention, Hannah. So actually now we will be moving on to a demonstration of the Health Information Portal. Miriam, are we ready?
I believe we are, Nienke. So now we're gonna show you live how the Health Information Portal can help you in your research. For this reason, we have invited a research from our research community, Marika Borg. Let me find her in the list. So, Marika, are you here with us?
Good afternoon. Can you hear me?
Yes, we can.
Yeah.
So welcome, Marika. Could you please introduce yourself and maybe tell us a little bit more about your field of expertise and research?
Yes, of course. I'm Marika Borch. I'm a public health researcher from Malta. I'm currently conducting research on the impact of the COVID-19 pandemic on cancer in European countries.
You're right. Perfect. Thank you, Marika. Could you please share your screen, especially the Google Chrome part, and go to the Health Information Portal. To do so, you can type www.healthinformationportal.eu.
Can you see my screen?
I think we can.
Good.
Perfect, Marika. So now you're on the home page of the Health Information Portal. As you can see, the Health Information Portal is a one-stop shop that facilitates access to population health and healthcare data, information expertise across Europe. You can see that on the right side of the screen, there is a full text search. So you were saying that you're interested in maybe learning more about cancer. So I would recommend you to maybe type cancer there. And if you're looking for a specific health information source, so like output for a country, you can already filter by country. Otherwise, you can simply type cancer and click on search.
Okay, so let me see what comes up with the keyword cancer. So for now, since I'm looking at information from all over Europe, I won't be choosing a specific country.
That's okay. Perfect. So as you can see on the left side of the page, there is a little overview of what type of information is provided. I believe that for your type of research, data and health information sources would be more relevant. So I would maybe recommend you to filter this research by clicking on the little box on the left side of the screen next to data and health information sources.
Okay, that's great. I think this will be very helpful.
All right, so the first one that we can see is the Malta National Cancer Registry. But if you go a little bit lower, you can see that there is the one from Austria, as well the one from Belgium, and I believe many other countries. So please, Marika, just open one of these data sources. You can start with your own country, but you can also opt for a different one.
Yeah, let me start with my own country first.
Perfect. So basically now you can find that all the information is organized following four main tabs. So overview, demographic, dataset, and content. So what we try to do is really to provide you detailed information about a specific data source. We do not provide you the data source itself, but we want to provide you with the information on how to access the data source. And this can be done by explaining you the process, or also by providing you with the contact information of the researcher or the research team that takes care of managing this health information source. So exactly, you can just go a little bit around and find more detailed information about this specific source.
Yeah, this is very useful for me. And I see that there's the email address, so I can contact the institution for further details. Thank you very much, Miriam.
No problem. This is what really the portal is here for. We try to provide you as much detailed information as possible, but we know that there are, of course, the people that might know more about it, so you can always contact them to ask your questions. Now, Marika, I think you said that you also would be interested in finding, exploring this topic of cancer, but more at the European level. So if you actually would like to do that, you can search different countries across Europe using the portal.
Okay.
To do so, please go on the top, there is this search bar, and one of them says search countries, one of the tabs.
Okay, here it is.
Exactly. Then below it says search national nodes. So could you please click on that? Perfect. So now you are on the national node homepage. Basically, a national node is an organizational entity, either formal or informal, that is often linked to a national institute that tries to work as a national liaison to bring together the different health players in a country. So in the map that you see below, it's a map of Europe, and we have many different countries across Europe that have provided information about their health information system and about their main health information sources. So all the countries that you see in dark blue, we have quite some detailed information, while the one in light blue, we do have some outputs, while unfortunately the countries in gray, we are still trying to make connection to them to add their information on the portal. So please, Marika, you were interested to find some more information regarding cancer. Just pick a country either by selecting it from the map or using the drop-down menu on the left side where it says choose a country. You can choose.
Yeah, let's try my luck with Finland.
Perfect. So now you are more on the home page of the Finnish national node. This means that you can find information of how the health information system of Finland is organized. And we also have a contact person, in this case, actually Hannah Tulonen, that is with us today. And basically this is to give you an idea of how the health information system is organized and what are the main health information sources, but also of course to give you like a person to contact in case you would have specific question. So please, Marika, go back up and then you can see exactly several different tabs. Now we are just in the info, so like the general information about the country, but you can go on the second tab that is called Health Information Sources and Actors. Perfect. So basically here you find the main health information sources that we have information on the portal at the moment for Finland. So there are different type of sources. So there are registry data, but there are also survey data. Some could be related to COVID-19, some might not. So it really depends on what are the main health information sources for the countries. So just feel free to select one of them that you might think it would be interesting for your work.
Yeah, I'm seeing a lot of health information sources, deaths, births, child welfare. Yeah, this is very interesting. And also Finland has the cancer registry, which will be useful for me. Yeah, again, I find a lot of information about the information source. And also
Exactly.
I have the email address so I'm able to contact the institute for further information.
Exactly, Marika. So this is how it works also for the different countries. We have some countries that have provided a lot of information. So a great example on the portal, for example, is the Spanish National No. There is really a lot of detailed information of main health information sources. And we constantly work to make the portal more complete.
Yeah, I also saw this one, the FinHealth 2017 follow-up survey, and I think it will be also useful for my research since in the keywords I'm seeing that it's on COVID-19 and it collects information on the health and well-being, so probably it will be very useful for me.
That is great to hear. Actually, something that I think could be very interesting for you, it's about the next presentation that we have prepared for you. Basically, we have a colleague from Austria, Claudia Habel, that will be introducing us to a brand new section of the portal dedicated completely to COVID-19. But before we give the word back to Ninka to introduce Claudia, Marika, do you have any other question for us?
So would you have any specific information on COVID-19 that can help me with my research and other things that maybe you think are useful for my research?
I believe we do actually. So if you go back up, there are several ways where you can find information. So as you can see, the second tab is called Search COVID-19 Measures, but this one we can leave it to Claudia because she will tell us much more about both the Rapid Exchange Form and the COVID-19 policy measure. But also going back to the home page, so just if you click on the European Health Information Portal, in your free time, you can just like type COVID-19, for example, in the full text search, and you will get all the results and all the different elements that we have linked to COVID-19. And this could range between data sources, capacity building, and much more.
Yeah. Thank you very much, Miriam. This was very useful for me, and I think that the portal will be very helpful to find information about all the data that I'm looking for, and I'm really looking forward to continue exploring the portal further. Thank you very much.
Thank you so much, Marika, for being with us today, and thank you for helping us demonstrating the use of the portal. We really hope that the portal will be useful for you in the future. Thank you again.
Thank you.
So thank you, Marika and Miriam, for this very nice demonstration. And Marika, we are very much looking forward to the results of your study. So are you now a researcher yourself and you want to find relevant population health data to conduct your studies, or you're interested in maybe other research networks that might also be doing the same studies or same research questions as you are studying, you can take a look at the Health Information Portal. So I think we're going to move on to new features because we have already mentioned it. We would really like to demonstrate new features that we have built on the portal. We have two of our FIRA colleagues online today who will give a short demonstration about these features. The first person I would like to introduce is Claudia Habel, and she is actually part of the executive board of the Austrian National Public Health Institute and head of its National Affairs and Consultancy Department. And in FIRI, she is leading the work on the infrastructure for rapid exchange between actors from competent authorities. But of course also researchers, advisors, stakeholders, all in joint efforts to handle the COVID-19 pandemic. And she will be demonstrating today our COVID corner on the portal. Claudia, are you with us today? I see you on the screen, perfect. Could you maybe share your screen and take us through? Thank you, and the floor is yours.
Thank you so much. I tried to share my screen already. Is it working?
It's working perfectly. Thank you so much.
Great. Well, it was mentioned already that an important milestone of this health information portal that was started even more conceptualized before the crisis hit us all. Still, we found it really important to have, like we call it internally, a Corona corner on this website. Hannah mentioned it before. So what I think I would really invite you to use this feature, which is, I think, a very valuable source of information. I start with the page on the COVID policy measures. I think it really offers a very good overview on countries. Most countries in Europe participate in this exercise, actually, not all, but most of them. And you will see where countries you see with measures available or countries where no policy measures are available. Now you can choose either for a specific countries, perhaps you travel there, or perhaps you want to research on it. I can choose Austria for the moment. And you will see on the spot with these flags if a measure is currently applied in the country, a measure is currently not applied, if there are other measures, and or if this information is missing. And so I think it's a pretty good overview if you want to check for lockdowns or the travel mobility in your country. You see we don't have health airport checks anymore or any restrictions on airports or borders, but still we have a recommendation in our country to avoid non-essential travel. And this, you could have a look for all the different topics, from education to testing to protective measures to, as I said, lockdowns and isolations. In my country still there's face masks mandatory, and not only regular face masks, but so-called FFP2 filter masks. You see, so this would be perhaps useful if we want to travel there here to know this information. We know that a lot of perhaps you have to go to a travel agency and you can check in the individual ministries of exterior affairs in some countries, but I think we offer a very good and simple overview on all the measures taken, and of course allow for an analysis in this field. So who is in charge, what is in place right now and what's not. Countries, our partners in this project, are invited to update this page regularly. Most of them do, but of course sometimes information with the now ongoing changes, it's important to almost check it every week. Sometimes we are a bit in delay, I'm honest with you, but usually we are doing pretty well, and so it allows you a really good overview. Besides checking for individual countries, you could also check for a specific measure. Let's select this recommendation on travel, for instance, or we could look for lockdowns. Perhaps you could check for use of lockdowns if there would not be too many, but perhaps these travel restrictions. You check, you can also see on the spot, Albania didn't provide information, but Austria did, Belgium did, Croatia has none, and so on. So I think it offers you a very good overview in countries where there are restrictions or not. And you always see clearly from which date this was updated. So which tells you if this information is really top-notch reliable, or perhaps if you would like to check again in the country requested. Well, what else can you see here? I think it also gives you a very good overview with a graphic feature. So you see really with one look if this measure, the recommendation to avoid non-essential travel, internal or external, is implied in one of the European countries. The other feature here, which I personally are pleased that we have it, because I run the work package that is in charge of this Rapid Exchange Forum, where the partners in this project and invited guests, very often, for instance, the ECDC, exchange information every 2 weeks since the beginning of the pandemic, more or less, on measures taken or things that are happening. We decided to share this information with the research public and interested public. And let me go to this Rapid Exchange Forum page. It also gives you information on measures, for instance, in the countries and what happened by topic. So you always see we had now already the 34th meeting of these countries. Usually 20 to 25 different countries attend. You see the topic that we have raised here. Last time it was the communication strategies. Before we had a discussion on exchange on the COVID-19 pandemic evaluation and so on. And if you then will go to the minutes, it will allow you per country information, very detailed form with links on which topics on the input of these countries. I hope this is big enough on the screen so people can see it. I try to increase a bit. It is always stated because, of course, things change and sometimes updates are shared. Let's say when we talked about the vaccination strategies of countries. So this is updated. You always can check for the date to tell you how accurate or most current this information is. But I think we can be very proud because we have a really good overview on these measures in all the countries on a very granular level. So you can check for yourself if you're an interested researcher or if you only want to know for other reasons. Perhaps I invite you all also that the crisis response teams of the countries are sometimes also involved in these matters, and most of us are working or advising at least these crisis response teams, because most of those who are in these meetings are sort of knowledge brokers between the, let's say, research community and the actual decision makers. So I think I have reached the end of my time. Again, I'm very pleased that also for Science Sano colleagues, their IT colleagues who made all these features happen. And I think it's really useful, and I invite everyone to use it and promote this portal. We think it will have a long and successful lifespan. Not only 1 year, but I'm sure we have a 10-year and a 20-year celebration also in future.
Thank you, Claudia. Thank you so much. I think we're all looking forward to this 10-year anniversary and 20-year anniversary. And thank you so much for this great demonstration. I think it really shows that the strong network that FIRA has been building and the unique collaborations that we have been building over the last 4 years, also in our previous project, the Joint Action on Health Information, really allow us to reach all these national contact points and to have this information that we need on the COVID-19 measures from the countries itself, validated and then directly uploaded onto the portal. Thank you so much for this great demonstration. Actually, I still have one question for you. So this bi-weekly meetings that you're referring to with this Rapid Exchange Forum, where you really facilitate this rapid exchange of answers to urgent policy questions, is this open to all the FIRA partners, or are there also other people participating in these exchange forum meetings?
It's basically open, of course, to all the FIRA partners, but everyone is invited to bring guests, and we have, as I said, other attendees also. ECDC is quite a regular guest. We had the JRC attending, Commission Services. Everyone who is really working on a high level in this field and is involved in the either crisis response or working in scientific affairs, like we have the Future Operations Platform in my country, they tend to be at least recipient of these findings of the minutes, for instance. So please share it.
Thank you so much, Claudia. And thank you so much for tuning in and showing us these features on the portal. Okay, I would now like to invite another key person in our FIRA consortium, Mariana Peroto dos Santos. She's actually a researcher at the Center for Integral Health Research at the Nova School of Medicine in Lisbon, in Portugal. And she is a specialist in digital health and health information systems. But in FiRI, she is involved in the part of our portal that deals with the capacity building. So trainings and courses for people who are working in the public health domain. Mariana, can you hear us?
Yes, I can.
Thank you so much for being here. Would you be able to share your screen and take us through this new feature of the portal?
Of course, it will be my pleasure. So in here, you can see the main page and the front page of the capacity building activities section in the health information portal. And in this section, you can find information about the available capacity building activities on COVID-19, population health, and health information. That is the main aim of the FiRI project. So this includes several capacity building activities organized by FiRI, as well other international health organizations and institutions. So in this front page, we have two sections important. It's the highlight of the week, space, and the coming activities. In the highlight of the week, it's some activities that are, and at least we're trying to show one. It's so you can see what is in this week or the upcoming activity that we want to share and disseminate with the aim that bring us more about FiRI. And in the coming activities is the next activity that will be scheduled since today. So in the end page, we can search all activities that will lead us to the catalog. But first, I want to also share with you that we have two activities, two drop menus. So the catalog, that it's a companion of all the activities past and coming, and also the European School on Health Information. First of all, I will explore a little bit of the catalog. In this case, in this page, you can find all the capacity building activities, and we have here a search menu, so you can filter the information, and you can see if it's a FiRI or not activity organized. Some of the topics, for example, I will share with you. Let's see. Let's try. I don't know what you wanted to see. Let's put any, and the country you can also share if you want, for example, an international. If it's an international institution, you can see the schedule if it's a permanent activity, if it's a monthly schedule or a fixed date activity, and also some of the categories. It's the type of the activity, if it's a seminar, if it's an e-learning activity, if it's a conference. So you can filter also in this case. So let's try to see which international organizations we have in here that are organizing some activities. And let's try to see a FiRI activity, for example. Let's try it. Oh, it's not international, sorry. So let's see, for example, the FiRI Roadshow or the webinar in digital and innovative tools. So this is all the information that you can find for one activity. And you can see if it's an online or a presential or a blended type of activity. In this case, it's a seminar. It was a seminar. And it was COVID-19 related, and it was a FiRI activity because it was organized by FiRI. You have here the date and the time. This is also the Central European time that you can find. And you can find the link to the activity in here. In this case, the activity link will be going to the page where the activity is going to be organized. But in some other ways, in some other activities, you can find the page where all the information and more detailed information you can read. So you can see the geo coverage is about Europe, the language is in English, and it's not available in other languages. But if you explore a little bit more of this section, you can find some activities that are also, for example, translated in Arabic, Chinese, and French, and other languages. In the target audience, it's another way that you can see for the main public that the capacity building is going to be organized. And you can select if you want, for example, to share with your institution, your decision makers and policy makers on your country, or regarding the public health authorities. This is a way that you can filter the audience of the activity. In the description, you can have a little bit more information about the activity. In this case, we have the agenda, but also the aim and and what is the goal of this activity. And you can find the topics, so the specific topics and specific themes that are going to be approached in this kind of activity. Regarding the organization, in here you can see that the lead organizer is Universidade Nova de Lisboa, in here in Portugal, and with partners of also the school University of Medicine in here. And you can see the last update dates in here. In this case, it was 4th of April 2022. But there are some activities that, for example, if they the organizer share some materials, some late, for example, some late recordings, we update on the description. And in here, you will see the links to be able to see the activity again or read some of the new materials. And then, for example, we have the European School on Health Information. This is another page where we're trying to share with you and to be able to provide you for an annual overview of all the activities that were organized and are going to be organized. In this case, we are on almost in the end of April. So in here, you can see that the next activity is qualitative research organized by European Public Health Association, and it will also have another one in 11th of May. This is always going to be updated, and if you want to check what is going to happen and what's happening regarding some topics, specific topics that you want to see, or it's easier for you to search some activity that you were presenting and you wanted to see more information, this is a really good way to search and to find more about this. And I think if you wanted to see, for example, I can share with you just, for example, in this case, if you want to see more about this next activity that is going to be organized, you can always see on the newsletter of FireEye that we wanted to share with you, and if you want to subscribe it. And you'll also see the next events, and if you want also to share with us your activity, don't hesitate to contact us and send us an email, and we will try to disseminate more of activities. Thank you so much.
Thank you so much, Marianne, for this elaborate demonstration of the capacity building section. I think this is a very interesting section for everybody who is working in public health, either juniors or seniors. I think everybody could really benefit to have them all in one place. I still have a question for you. So I think there are also other organizations who have a lot of trainings listed. I know that the ECDC, for example, other research infrastructures, maybe as Elixir. How does the portal work with them? Are there any collaborations set up between those parties?
Yes, that's a really interesting question, because from now, I think it was last month, we are trying to build partnerships with the relevant institutions that are also organizing capacity building activities in this scope. And as you said already, ECDC as the Virtual Academy, and some of the activities that we share in here are from the ECDC institution, and we're also trying to build partnerships with the TESS, for example, and try to scope the most capacity building information and activities that we can.
Fantastic! That is great news. Thank you so much, Marianne. And I think that is really something to look forward to in the future, to have this really linked. Thank you so much for your demonstration and joining us from Portugal.
Thank you so much.
Okay, let's now take a look at the future. Hannah mentioned already, there is still a lot to be done, and we are wondering what these next steps are for the Health Information Portal. And I see that Pascal is now joining us online. And actually, Pascal is working as a data engineer at Cienzano in Belgium, and he's working on the technical aspects of health information systems that we are implementing, or information systems. And in particular, he looks at maximizing the use of metadata. So for the Health Information Portal, he is mapping the existing information that is now on the portal to schema.org. Pascal, could you tell us a little bit more about this? You are still muted, Pascal, so unfortunately you have to start over.
Yes, sorry. So
Thank you.
Good afternoon, everyone. I'm going to share a few slides to provide you more explanation on what we are doing now, what kind of technologies we are implementing. So click here. You should see my screen with the first slide about your question, Ninke. What is schema.org? Schema.org is a structure markup that you can add to your HTML documents to help search engines understand your content. So we are speaking about the web and the link data. So just to simply illustrate the idea, if I publish the age of Anne on the internet, the machines will hardly understand the information provided in the web page. So one idea is to use schema.org. If I define the type of the information with schema.org control vocabularies, it makes things clear for machines. You see here, I'm using the control vocabulary name and age so that my machine understand what is the information about. Now, the European Health Information Portal has a lot of information available for humans, like information on national nodes, information about health information sources, and so on. What we are doing is we are mapping this information using popular schema.org to different types. For instance, you see, I was mentioning a national node, and we are mapping it to organization. Like, for instance, also for the health information sources, we are mapping this to data sets. So it's mapping this information, of course, improves the search engine visibility. But it's not only this, it's also philosophical, I will say. And here I've got a quote from Tim Berners-Lee, who wrote, "Properly designed, the semantic web can assist the evolution of human knowledge as a whole." So to say Tim is one of the inventor of the World Wide Web. And by doing this work with the Health Information Portal, by implementing schema.org, we are greatly contributing to the dissemination of knowledge. And this is very important to say. And doing this work, we look also into the future, and we are also working on the implementation of a metadata catalog, which will be DCAT compliant. It's a bit of technology, I'm sorry, but DCAT is RDF vocabulary designed to facilitate interoperability between data catalogs published on the web. So this keyword interoperability is very important because it's all about dissemination of information. And here what we are looking into is linking metadata catalogs between them, and the health information is one of these catalog which provides knowledge to our user community. So,
thank you so much, Pascal. And I think this is a really great exercise for our health information portal, really to use this DCAT standards to make the data that we have more findable and more readable. So I was wondering, do I understand well that this DCAT metadata standard that you're mentioning now is also the recommended standard by the European Commission?
Yes, exactly. That's correct. The European Commission is promoting the use of DCAT application profile in Europe for the establishment of metadata catalogs. That's true for all domains. That's also true for health data. And we foreseen to use these standards for the implementation of the European health data space.
Thank you, Pascal. So the health information portal will then, in the end, fit perfectly within this newly to build European health data space.
Yes, exactly. We are improving our information systems in order to connect them and to provide to users more information, more relevant information and knowledge. I think it's very important nowadays to say that our researchers are doing a great job and the policy makers can rely on the accomplished work.
Thank you so much, Pascal, for these great words and for your intervention.
It was a pleasure.
Thank you. All right, I think we're moving on to the final part of today's event, the Q&A. Our guests have presented quite a lot of information to you. We started from the journey that started 5 years ago when we were starting to build the portal, to all the new features that were presented to you today, with all the newest glimpse of the future, using this DCAT standards to make the portal really fit into this European health data space. So it's time to check if the participants and the attendees of this event have some questions for us. Miriam.
So I don't see any question at the moment yet in the chat, but feel free to still type it in the chat. We are in the WebEx webinar function, so unfortunately you cannot take the word freely, but if you just type your name or a small message, I can put you on stage so that you can also broadcast your question live. In the meantime, so I will still give you a couple of minutes if you want to write a question. I will briefly share my screen to show you how you can provide us with feedback on the portal. So we have been working a lot on the portal, but we know that we can always improve. So we do have basically a function or like just a place on the portal where you can provide us with feedback. So I think now you should be able to see my screen, and I will just go on the home page of the Health Information Portal. So this is just the home page, and you can see that on the right side there is a tab called Contact. So if you just click on it, you will be able to find this form. Actually, my information are filled in automatically, but we just would like to, of course, get your email address so that we know where you can reply to you. And just the subject. And in here, you can type maybe if you have found a bug, or if also, more importantly, if you would like to collaborate with us. So if you want to get in contact with a specific person for a health information search where like the contact details are not provided, or if you would like to maybe contribute to the portal, we would be more than happy to get your emails at this point. So just feel free, this very short form, type here your message, and we will be receiving automatically your email in our mailbox, and we will try to reply you as soon as possible, of course.
Thank you, Miriam, for showing. I think it's really important to realize that this portal is being filled by all the partners that we have in FireEye. So in the FireEye consortium, we cover more than 30 European countries, and we have more than 41 partners. So this means we have a lot of information that we can put into the portal. However, of course, there could still be data sources on population health or healthcare data that we're missing. So if you are currently hosting some of these data and you would like them to be more findable and more accessible for researchers, or also for advisors and policymakers, just to see how much information is out there, you can contact us using this contact form, or directly using the email address in the chat, and then we will help you set up the information on the portal.
Thank you so much, Nika. I've just been checking the chat, and I see that Pascal is asking us if we have a Twitter account and a LinkedIn page. So I would kindly ask my colleague Bartholomew to put this information in the chat. Maybe I can also just very briefly show my screen so that you can see how the Twitter page and also the LinkedIn page of FireEye looks like. So if you want to tweet about this event, you can find a lot of information on our Twitter page. This is our Twitter handle. so at FARE for EU. And we also have a LinkedIn page that would, you just need to type FARE Population Health Information Research Infrastructure, but with already FARE, you'll be coming up. So if you want just to stay informed about our different activities, there are many different channels you can use to do so. So Twitter, LinkedIn, but also our website, for example. It's a great way to stay informed about the different activities we are organizing. So from my side, this is all. I give the word back to you, Nienke.
Thank you, Miriam. Is there anything we would like to add to this? Maybe looking at Hannah, who has just been traveling to Brussels. Do you think that this event that we did today has covered all the features of the portal, or are there still some messages you would like to get out to the research community?
I think we have got quite a good snapshot on what's on the portal, and I encourage all online to just dig into the portal, play around, look what you can find there. And as said, all the feedback, most welcome, because without feedback, we cannot have improvements on the portal. So we are looking for your comments on that. But more you use it, also that will provide us more information on which bits and pieces of the portal get to be used. And that's our cue to add information and extend it. So just to encourage you, dive in.
Exactly. So please keep an eye on the portal, because we will be adding a lot more features and a lot more information in the coming, I could even say days, if I might say so. So I think hereby we have come to the end of the event, and I would like to thank you all for participating. So today we have celebrated the 1-year anniversary of this portal, this one-stop shop where catalogs of population health information are now findable through just one single portal.
Before we close the meeting, I would really like to thank all the speakers that have been today with us, but also all of the FARE partners and beyond that have really put a lot of work into the Health Information Portal. We are fully aware how much time this might have taken you, but we are also very proud to see how the portal is looking like now. And also we would like to really give a special thank you to all the ICT team, to our colleagues Pierre, Thibaut, Alan, Eric, Gilles, and Jonathan, because they have really helped us a lot. Like, this would not have been possible with all the help from the ICT team. So really a big thank you to all of you.
Thank you, Miriam. And I would also like to thank Hannah, who's been traveling all the way today to Brussels to be here with you today to provide you with some information about their journey. And of course, we would like to thank the PI of our project, Petronile Bogert, for all her efforts into making this project a huge success. And with this, I would like to thank everyone for participating in this event, and have a great weekend. Thank you.
Thank you, everyone.
Thank you. Bye-bye.